5 second lag.
Mhm.
10 seconds. Hi, everybody, and welcome to Homeopathic Voices from Around the World with me, Atiq Ahmed Bhatti. Now, this is a very special episode, episode 27, with the fantastic Dr. Lauri Grossman, who's the president of the National Center for Homeopathy, and the amazing Marjorie Stearns, who is actually the conference chair for the upcoming Joint American Homeopathic Conference for this year. We'll refer to this as the JAHC. It's much easier on the tongue, but it's going to be really something absolutely fantastic. So Dr. Lauri Grossman and Marjorie Stearns, thank you and welcome, and virtual hugs.
Virtual hugs are right back.
So there's so much going on, isn't there, within the world of homeopathy? And I feel that the Joint American Homeopathic Conference, the JAHC, is really up there as far as global events are concerned, and uniting homeopaths, bringing together an absolutely stellar lineup of speakers. But for the many who may not be aware, please share, what is the JAHC and how did it actually start? I mean, it's such an amazing concept and idea, and which is now obviously a reality.
I guess I'll take this. I want to save your voice, Marjorie, to discuss the speakers because you're so familiar with the lineup, being the chair of the conference. So the conference used to be called the National Center for Homeopathy Conference, but several years ago, it was transformed to the Joint American Homeopathic Conference because we wanted to pull in all the different American homeopathic organizations, and we have quite a number of them. Each profession has its own organization. So there's the AIH, which is an organization that represents doctors that practice homeopathy. The naturopaths have their own organization. Nurses have their own organization. So veterinarians have their own organization. So the Joint American Homeopathic Conference pulls together everybody. And it even pulls together home prescribers. So we have a home prescriber track, and then we also have a track for professionals. So professionals can get continuing education credits, whether or not you attend online or virtually. And so it pulls together the entire homeopathic community. We have many, many different manufacturers and schools and homeopathic support organizations that are in our exhibit hall. So it's a fabulous time to pull the community together, and more we get more international attendees. And of course, under Marjorie's fabulous guidance, we've created a hybrid program so that people in other countries don't have to spend the money to travel to the States, but they can attend online, and they can attend online and actually catch the sneak peek day, which is a free day on Thursday to just check out the conference, or they can then attend the 3-day full conference or bits and pieces of it. And you can get more information about that if you sign on to jahc.info. So that's where you can go to register. That's where you can go to find out about the speakers, the special events, et cetera, et cetera. And now I'm going to pass the baton over to Marjorie, who could tell you more about the speakers.
Yeah, and I just wanted to mention that prior to the pandemic, this conference was always in person, and it was a wonderful time to come together in person and meet face to face, the speakers, your teachers, your colleagues. And with the pandemic and being forced to go virtual, that was hard. But as we came out of that and went to a hybrid format, it's been wonderful. And now we have the best of both worlds because you can still come in person or you can join us online, and we live stream everything through the weekend. We have recordings, and it used to be that recordings were difficult, and now the AV's improved so much that it's easy and seamless. And each conference registration includes access to the recordings. So you don't have to pay any extra to get those. You get the full recording access. And we have multiple tracks running, and you don't have to try to run between rooms because you're going to get all the recordings anyway. And yes, we have a fantastic lineup of speakers. And Atik, you wanted to mention something about the international speakers that we have. You want to give some,
Absolutely.
some comments about that?
Yeah, I mean, absolutely stellar lineup, isn't it? And we were just saying just before we went live that it's such an important event. I feel as far as the homeopathic calendar is concerned throughout the year. This is really up there as an opportunity to meet one another, to strengthen friendships, relationships, to learn, to get the insights and experiences from the lineup of speakers, which are from around the world. And I mentioned to you that some of my friends like Dr. Farooq Master and Dr. Samir Chowker and Dr. Jitesh Sharma and many, many, many more, of course, and Rachel Roberts, of course, from the UK, they're all going to be there in some shape or form. And it's just, it's brilliant. So do tell us more about the lineup. I know there's plenty of speakers to go through.
Yes, and we tried to have a variety of different people with different licenses or different backgrounds. We have some veterinary homeopaths speaking, including Dr. Richard Pitcairn, which is trained the bulk of the homeopathic vets in the US and around the world. And we have naturopaths that are using homeopathy in their practice. And we have other, different practitioners, the nurses. We have several nurses that are in the lineup, as well as credentialed homeopaths. So that's amazing. And we have Divya Shabras coming from India also. And let's see, we mentioned Rachel. I know Kim Aaliyah is there. A lot of people know Kim Aaliyah. And in the US, we have Miranda Castro is joining us virtually, and
Really?
Karen Allen. Yes, so it's really something for everyone, whether you're just learning about homeopathy or well-seasoned, there's something that everyone will get out of the conference.
It's like the Oscars for healthcare, isn't it?
Yes, it is.
Honestly, it's brilliant. What a lineup, I tell you. And that's just a few of the names you've mentioned. I know the list is very, very long indeed. And of course, if people are interested to know more, of course, head over to jahc.info, yes?
Yes.
Now, I wanted to ask you about the special events. And then, Lauri, I wanted to move to you about the 50th anniversary. So yes, you heard it right. 50th anniversary celebrations as well. So, but Marjorie, if you can just give us a taster of some of the special events that are lined up.
Yeah, sure. So we have we have a film premiere of the new movie coming out, and in person we're having sort of a black tie optional, fun Hollywood type screening, but it is being live streamed also, and you can go to the Inspiring Homeopathy movie website, Introducing Homeopathy website that has a link to register virtually from home, or if you're in person, you can join us in the ballroom there. And that's going to be a big, fun, special social event. We also have because it's the 50th anniversary, NCH was created in 1974. And so we are having a 1970s themed dance party there at the hotel. That part is not live streamed. You need to come and join us, or you can wear your 70s gear at home and think of us. On the day before the conference, we are doing a Washington, D.C. bus tour, including stopping at the monument of Samuel Hahnemann in Washington, D.C., which is the only monument in the U.S. That is dedicated to a medical doctor, and it's Samuel Hahnemann. And so we're going in person there. And let's see, we have loads of meetups during the breaks, and even on our virtual platform, we have a video lounge that anyone who's registered virtually can enter the lounge and turn on your camera, and you can have meetups with people from around the world and talk about the conference, just introduce yourself to each other. When we have coffee breaks or lunch in the hotel, we're encouraging our virtual attendees to drop by the lounge and turn on your camera and meet some homeopaths or people who are passionate about homeopathy from around the world. So those are some of the special events that come to mind.
Hey, you should have a little booth, like a photo booth. JAHC.
We do. We do. We have a big 1970s backdrop, and we're going to have a box of props. So maybe we can get you some pictures that we can get all over social media.
That'd be epic, wouldn't it? Yeah, that would be.
Get the speakers and dress up.
Meet a homeopath, and have your photo taken.
Yes.
Right. So you have to come into the photo booth first in a ball gown, and then you have to quickly go into the changing booth and come out and your tie-dye
70s.
and beads and your flower power shirt.
Yeah, absolutely.
Yeah. And let me just remind people that if you want to find out more information about the film, or if you want to purchase a ticket for the film, you can go to introducinghomeopathy.com. And there you could see a trailer on the film. You could find out who collaborated on the film, a lot of information about the film, and then you could also purchase tickets there.
Actually, for those listening and listening back, of course, just a couple of days ago, I had the good fortune to have a special exclusive sit down with the production team at Introducing Homeopathy. And Kim Aaliyah, the producer, was able to share a world exclusive clip from the upcoming film, which has not been seen by anybody outside of the production team themselves. So do check that out on YouTube, on my YouTube channel. You'll find it under Introducing Homeopathy. Now, I wanted to ask you about the 50th anniversary, and I mean, congratulations, number one, and number two, Lauri, how has the JHC itself evolved, and what have you seen? Actually, I'll ask both of you, Marjorie and Lauri. How has it evolved as far as you're concerned, and because it's such an amazing place that it is at the moment, and it's come so far, isn't it? And it's so. I mean, I just find it's so professionally amazing, It's so well put together.
Well, I'm glad Marjorie is on the call with me, because we can speak about the development of NCH from very different perspectives. When I first became a member of the National Center for Homeopathy, there were no schools for homeopathy in the US. And I remember when I wanted to study homeopathy, I lived in New York. I remember looking into naturopathy, but it was only taught on the West Coast. There were no, New York wasn't a state where naturopaths could get licensed. And it was such a challenging jumping through hoops, and what are we going to do? And the National Center was one of the few places where you could take any class in homeopathy. And it kind of was a very homey, down to earth. We met on college campuses or very low key venues. And then as certification became a part of becoming a homeopath, going to homeopathic school, going to a credentialed school, the National Center for Homeopathy had to grow with that. Our magazine, our little, simple magazine, became a color, high production magazine. Our conference, which was very low key, we had then all the different homeopathic manufacturers, and then the different schools, and then the different advocacy organizations wanted to be a part of our coming together, as did Homeopaths Without Borders. So more and more organizations were growing, more and more credentialing bodies were created, and NCH had to expand to include that. Now, mind you, we, from the start, wanted to be an inclusive organization. And you'd be surprised when, people talk about inclusivity and diversity, but there are many different voices in the homeopathic community. And NCH has strived to welcome all the different voices. And I know certainly while I've been president and the board I've worked with, which Marjorie has been a major player on the board, we really try hard to reach out. I spend hours a day on LinkedIn trying to meet different homeopaths from different communities who graduated from different schools, finding out what their focus is and how they feel they can contribute. And we have meetings with major stakeholders, such as the heads of the different schools, the people who work in the different manufacturing labs, the people who work in the credentialing bodies. We try to stay abreast. We try to welcome everybody. We try to move the profession forward. And I think this year, our commitment in hitting our 50th anniversary is now we truly want to bring homeopathy onto the main stage in healthcare around the globe. And that's why Kim Aaliyah has been such a fabulous partner with the National Center for Homeopathy, because his film is having its premiere screening at the 50th anniversary conference of the National Center for Homeopathy. And I think that is a true coming together. It's just very synchronous. And, you know, the creation of Homeopathic Research Institute, you know, in the UK, Atik, your homeopathy health podcast, all of these things are now just it's like it's growing exponentially, and we're all trying to hold each other's hands as we move the entire profession forward. And it's an exciting time for each individual organization, and it's a super exciting time for the organizations as we weave together our passions, our interests, our efforts, our missions.
It's amazing, isn't it, Marjorie? I mean, and also the timing is so good here, isn't it, with the film release and the fact that you've got your 50th. I think things have come to, I mean, I can't, you know, Lauri's words are so eloquent, you know, but, and I echo them. Everything seems just right. This moment in time, this year can be a moment itself. The next few months can be a moment, but this is truly the year for homeopathy. And, you know, it's so important that everybody comes together and we collaborate and we work together and we promote all things homeopathy, because the more people that are going to know, I mean, my God, it's life-changing, right? They're going to benefit so incredibly. And for those listening, actually, I would urge you to go to jahc.info, have a look at the lineup of speakers and have a look, because I'm 100% confident there'll be something, one speaker or a subject that will really interest you, and you'll think, you know what, I want to find out a bit more about this, and what is the homeopathic perspective on this? And yeah, please, Marjorie, do give us an idea of perhaps some of the topics that are being covered.
Oh, yes. So we tried to include just about every topic, and we have everything from first aid at home. Lisa Amarine is a naturopath, homeopath, who is giving a talk on wilderness first aid for, you know, kind of out in the wilderness. And that's going to be really interesting. And then we have talks on children's issues and autism and ADD. And there's skin talks. We have talks on back pain, women's health. There's several talks on women's health issues. And we have, let's see, mental health, several talks on working with mental health, depression, stress, anxiety, things like that. It just, the list goes on and on. We try to, we work with the speakers to, you know, get a wide variety of just about every topic. And I also wanted to mention that in our exhibit hall, we have about 40 exhibitors in the hotel, and they represent all the segments of the community that Lauri mentioned. And we have manufacturers, and we have, you know, the schools are there, and we've invited, in the US, we have state and regional organizations that are having tables, and we even have international that come, like HRIs on our virtual exhibit hall. So even if you can't come in person, like if you're there in person, you can go around the room to 40 tables and meet just people from every corner of the homeopathy community. It's amazing. And then online, they also have virtual exhibit booths in our platform. So even if you're not there in person, you can log in, you can enter the virtual exhibit hall, and all these organizations have spent hours setting up their booth, and they have a little booth with video screens and documents, and you can collect documents, you can download documents. Many give away, like a lot of the educational organizations give away classes, they give away all sorts of infographics and really useful information. And I think we have about 45 online exhibitors, because some are not able to be there in person. And I wanted to also make clear that something that we're doing new for the 50th anniversary only, we may never do this again, is we are opening up the platform on the day before the conference for what we call the free sneak peek. You can register if you go to jhc.info, click on the registration, and then you can register for the free sneak peek only. It is free. It costs you nothing. And that allows you to log in next week on Thursday, and all the times we use are Eastern time because it's Washington, D.C. And you can log in, and we have about 6 or 8 pre-recorded talks that are free that day as a sneak peek of what you can get at the conference. but we're opening up the exhibit hall. We debated about doing that or not, but we're going to do it. So we're opening the exhibit hall. You can go into all the booths, you can download things, you can read things, you can run all over the platform. And then at the end of Thursday, all that closes. You lose all the access. There's no recordings, nothing for free, but there you can upgrade. It will give you a taste of what the conference is like. So you can say, you know, I want more of this. And then you can come live on Friday, Saturday, Sunday and see speakers or get all the recordings if you can't be there live. So definitely check out our free sneak peek. It's, you know, you can't lose anything, and it will really give you a taste of what JHC is like. Yeah.
And I think while everyone is looking at JAHC, also visit the National Center for Homeopathy website. Just Google it. It's first hit on Google as well. But, you know, Lauri, you were mentioning something about how the content and the magazine, for example, has evolved. Now, I get the newsletter, the e-newsletter from NCH, and as a content creator, I suppose, I say, it's absolutely stunning. I mean, really, I'm not just saying that is something, you know, I'm thinking how well it's put together, the way it's formatted, the way the information is presented. It's snappy, it's short, it's packed full of knowledge. It makes you want to click the link. It makes you want to do that. And I think that's just brilliant, you know. So congratulations, because honestly, that is one of the best newsletters that I have ever, e-letters certainly for me, that I've ever seen. And I genuinely mean that.
Well, it makes me smile to hear you say that, because we really struggled for years trying to figure out a good format for the newsletter. I am not one of the people working on it, so I can't take any credit whatsoever. Christina Donka is a major player in creating the newsletter. I think Mary Cutts is also involved. And the newsletter highlights issues of the day. So, of course, if it's springtime, we're going to have allergies that are mentioned. If there's a situation globally in the world, we'll be sure to address it in the newsletter. And we finally figured out things that are really, really helpful to people. In other words, if there's an issue of the day, we don't jibber jabber about it. We create a one-pager highlight of how homeopathy can help with that issue. And it's clearly written. The layouts are great. The design team is fabulous. I mean, I can smile when I'm saying this, because whenever I get the newsletter, I'm almost always writing back to the newsletter team, you hit it out of the park again, because it's well presented, clear, succinct. And trust me, if I read the entire newsletter, that shows that it's a good newsletter. I have far too many emails in my email box. I never read newsletters. They're a pain in the butt for me. But I read our newsletter every time, because it's incredibly valuable information presented in the simplest, most succinct way possible.
Now, Marjorie, the JAHC is the homeopathic Oscars, isn't it? Because there are also going to be some awards given, right? So do share, not who's going to get the awards, but just because I might spoil it, but just do talk about that sort of element of the content.
So we do have awards given, and we take several months to look at nominations and decide on who will receive these awards. And on the National Center for Homeopathy website is where I believe we list our past award winners. So if people want to go check that out, we've had many interesting past winners for that. And we have an award that we give for like who's contributed the most to the homeopathic community. And Lauri, you correct me if I'm wrong with this, because you're really good at the awards too. We have like the overall, contributor to the community. We have an award for research. We have, and then what's the third one, the main one?
Well, there's one for who has contributed the most to the profession in terms of education and scholarly research, et cetera, et cetera. Then there's a different one for who's contributed to the National Center for Homeopathy.
That's right. Okay.
So there's one for homeopathy in general, and then there's one for the National Center for Homeopathy, and there's also a research award as well.
And then was it last year or 2 years ago, we introduced a new category after getting many requests for education,
Hmm.
specific to
Right.
education. Yes.
Right.
Yeah.
And I mean, everyone should know that when the National Center for Homeopathy opens up the discussion about the awards, the first thing we do is we send out a call to all of our members to nominate people and to give us reasons why they feel this person should be nominated.
Hmm.
And it's quite touching what people have to say about educators who've meant so much to them, about practitioners who have, hung in there when they had, difficult conditions, or teachers, educators who've authored excellent books that have made practitioner prescribing and remedy selection that much more effective, and made a difference in how the outcomes from cases. So it's actually, you call it the Oscars. We don't give out gold statues, but we do give out our cute little blue crystal raindrop, which is actually quite stunning.
Beautiful.
You must send me a pic of that.
Okay, definitely will. If you go on our website, I think that our website is homeopathicenter.org. And if you go on to, I know it's listed on our website.
The menu.
Yeah, then you could see, since now we have a virtual conference, we do have, in the past few years, we have the people's acceptance speeches posted online. It's kind of fun, you could see Miranda Castro, who has such kind things to say about the National Center for Homeopathy. I mean, there are countless homeopaths who are central to the homeopathic community who've gotten awards, and to hear them reflect on why the National Center means a lot to them is really quite touching. Jeremy Scher, I think his videotape is still up there. So Loretta Butehorn, who does a lot of work with people with addictions. It's quite touching, truly is.
So that takes me on to those who may have missed the hybrid and the virtual the virtual opportunity for those to attend. So Marjorie, can you just go through that one more time, just so everybody's fully aware that the conference is in person, but also it uses a hybrid model, which is just brilliant for so many things nowadays anyway. I mean, this is virtual, isn't it? And it's brilliant. So
yes, it is. And that was one thing when we had to go online completely for the pandemic. In the conference feedback, we received a lot of feedback from people who said, like even in the US, that said, I can never come in person. I'm so thankful that you finally aired something virtual, because like I, have a like physical disability, or I'm taking care of a young child, or my elderly parents, I can never come in person. And then by going online, we also opened it up globally, really, to anyone to join us, because it's so easy to hop online. So we use the conference platform called vFairs, and they're a professional conference platform. And the sessions are run through Zoom accounts. And so it's just like what we're doing here. It'll be Zoom webinar format. And during the sessions, you can type in the Q&A box and ask the speaker questions. So you will be, even if you're not there in person, you can get your questions answered in real time. We have 52 speakers, and only 3 of them are presenting from offsite virtually. They're live, but they're virtual. The other 49 are in the hotel with us, which is really exciting.
wow.
So we get to meet them in person, yes, and shake hands and talk to them after. We are live streaming from the hotel rooms using a professional AV team. So you'll have very good quality through Zoom, being able to watch live. And then all of the sessions are recorded and placed on the vFairs conference platform, and they stay there for 30 days. And so you can log back in, go to the auditorium, find the session on the agenda, click it, play the recording over and over. We have slide handouts that you can download. And then after 30 days, we move those recordings to the jahc.info site. And all of that is for people who have paid a registration to see the conference. Now, we also added a lot of on-demand pre-recorded that are included in your conference ticket. And those recordings will be up they're already up now, but when you can access the site next week, you can start watching those. And they also stay 30 days on VFairs and then go to jhc.info. And we give access through the calendar year. So December 31, 2024, all the JHC 2024 recordings are taken down. It's plenty of time to watch, 8 months, something. And then new this year, as we talked about, is the Thursday sneak peek, where you get to come in on Thursday and see a handful of pre-recorded to see what the conference is like. And so during the conference, if you are joining us virtually, you can interact with speakers. You can go in the virtual lounge and chat with other attendees. And also there is a chat box on the virtual platform that you can type in and talk to people there too. So there's a lot of interaction between the people, and we are trying to encourage people in the hotel to log into the platform and, interact a bit and say hi and things like that. And after the virtual speakers present, they go to the video lounge to take any further Q&A. So you can talk to Karen Allen and Miranda Castro and Heiner Fry. Those are our 3 virtual presenters that will go over to the lounge after and continue the Q&A. So it's really an interactive thing, but if you miss something, you've got a recording. Yeah.
Brilliant. That's so exciting, isn't it? It really is. And I do wish you the best of good fortune with this, best of luck. And I think it's going to be absolutely incredible, like it has been. But I think this year is a very special year for so many reasons that, you've both alluded to. Now it takes us on to the jet set lifestyle of Dr. Lauri Grossman, because for those who aren't aware, and this is not for holidays, by the way, this is for work, but Lauri travels around the world to meet homeopaths, communities of homeopaths, organizations, and it's such an important aspect of her work, but it's also an important aspect of who she is as a person, and the love and the zeal and the passion that she has for this. So I know that you've been to South Africa, Zambia, and Zimbabwe. Am I correct? And yeah, do share how was that, and
Actually,
why, and how, and when?
well, I just came home, and actually, it was a very, very special trip for me because I didn't anticipate meeting anyone who was so well connected with the homeopathy community in South Africa. I met Lauren Brom, who is a graduate of the homeopathy schools in South Africa, and there are actually 2 homeopathy schools. There's the Durban University of Technology, and then there's also the University of Johannesburg. And it was wonderful to meet Lauren in Johannesburg, and she was telling me about all the projects that the students and the alumni have been partaking in. She was telling me about a program at not-for-profit rural clinics that are run through the Kula Natural Health Center. I don't know my South Africa geography too well, but I do know there's a clinic and forgive me if I'm mispronouncing this, KwaZulu-Natal and in Eastern Cape, Limpopo. And so I know that many people in the US are familiar with Jeremy Sher's program in Tanzania, in the Kilimanjaro region of Tanzania. And Jeremy and his programs, they teach first aid and their training programs. And many of these programs in Africa are run on similar models to the model that Homeopaths Without Borders runs in the US. And that is, they offer help and they offer care in their clinics, but then they also train the local people in homeopathy. So it's a beautiful program. So you're not creating a community of people that are dependent on outsiders for their health care. They wind up having community members, community leaders, able to address their health needs in the local clinics. There's also the Pan-Africa Medical College, Pan-Africa Homeopathic Medical College, that's in Nigeria. There's the Ghana Homeopathy Project, where that one has UK-based mentors that run outreach clinic. And then, of course, there's the Kenya School for Integrative Medicine. many old timers, including myself in the US, are familiar with Richard Pitt. He was from Portsmouth, England. He was a major player in developing that school. And actually, for anyone who is living in Kenya, interested in learning homeopathy, I think they have a new class that will begin. They're doing intakes now for their class that starts May 13th. So that's just around the corner. And many of these clinics also focus on community health, social services. There's tremendous community engagement in each of these schools. So here we are talking about 5 different countries who have different types of schools. Each one of them teach homeopathy in a slightly different way. They include different topics in the curriculum, so they're very varied, just as they are around the world. And it was just a joy for me to be in Africa to be able to learn more about these schools. And I've been to Africa twice before. I look forward to going back, but I think my calendar is getting full for this year. There's just so much going on around the world. I do know that the CEDH program is having a conference in Brussels, and that will be on homeopathy for integrative approaches to cancer treatments. The LMHI conference is going to be in Sevilla, Spain, and it's a fabulous conference that is going to have numerous speakers from around the globe. And HRI, Homeopathic Research Institute, just announced that their next conference in 2025 will be in Greece. So those are just a few places I'm going to visit.
Well, hey, I might actually see you if it's in Europe.
Okay.
That would be nice.
Yeah.
And you mentioned Kenya actually, and that's where my one of my uncles resided in Nairobi, and he was the founder and chair for the Kenya Institute of Alternative Medicine. And so yeah, so that brought back some memories as well, Right. So, I mean, how do you actually find meeting these organizations? So you mentioned Zambia and Zimbabwe. You mentioned, of course, the work that Jeremy Sher and is doing in Tanzania. And it's interesting, isn't it, how by training the local population, how homeopathy can become so incredibly powerful for the local community, because you've got people who are speaking the local language and the various dialects, and they're trained in homeopathy, so they can help so much in such a professional manner, in such an amazing manner, right? And I always find that fascinating, and there's so much work going on. And how do you see that evolving? I mean, is it just, it's on the up and up, isn't it, as far as that is concerned?
Well, it's a great question because it's revealing a global trend, at least in the homeopathy community, but I'm pretty sure this is happening in other arenas as well. For many years, for decades, people looked at NGOs, non-governmental organizations, who offered free services as lifesavers. But what was then experienced was that these local communities, their health improved or whatever it was, depending on what the NGO was servicing, if it was clothes or water or whatever it is. But then this population became dependent on the people from the NGO showing up. So sometimes the NGO ran out of funding. And so these people were left high and dry. They then became dependent on the NGO, and then the NGO disappeared. Or perhaps there was a time where a certain NGO was popular, lots of people wanted to volunteer, and then they ran out of volunteers, and then their efforts stopped. And then again, these people were left high and dry. So slowly but surely, organizations started to transition into taking their skill set and training the local population in that, so that the local population could care for itself. So, I mean, the organization I know best is Homeopaths Without Borders, because I went to Haiti so many times. And at the beginning, we treated the people who showed up at our clinic. But then Halim Nugent got involved, and Lauren Fox became involved. And now I don't even know the names of the people who are on the board of Homeopaths Without Borders, but they started training the the nurse midwives, the midwives. And that was a tremendous step forward, improving the health of mothers who were laboring and newborn health. And so they started training one group of women. It was very successful, another and another. And then I think, I don't quote me, I could be wrong, but I think they wound up training people in 6 different regions. And I think that trend is not only happening with Homeopaths Without Borders in wherever they're working, but it's also happening in other, I know in Jeremy Scher's program, they are also training local people in homeopathy. I know they do a lot of training in first aid teaching. And it's an exciting time where we are not only bringing our skill set, we're sharing our skill set and then gifting that skill set. And that is really, it improves the system of health.
It just goes back, doesn't it, Marjorie, to homeopathy and how giving it is, isn't it? It's all about giving. There is no taking, actually, in homeopathy. It doesn't exist. It's about helping people at any level and wherever they may be. And, it's so important, isn't it, as a message? We are here to help. We're actually facilitators, right? It's the person himself or herself that does the work, as far as principles of homeopathy. We're just facilitators, but what a beautiful position to be in, isn't it?
Yes.
It's just so nice.
It is. And that's what the feeling at the conference. The committee works so hard and the speakers work so hard to prepare and the exhibitors work so hard and they're all just giving and giving and giving. Yes, it is. It's wonderful.
It's wonderful. What, after the JAHC, Lauri, are you going to take a break? Because it's full on, isn't it? All the time. I follow you on social, so I know what you're up to. It never stops.
Well, the break I will take, the next effort that the National Center has is we are creating these meetups all around the country, actually all around the continent, because I'm working on one in Canada as well. But Marjorie was with me when I traveled to Washington State. And what we're trying to do is go to different areas. I'll just say mostly in the US right now, but who knows with me, next thing we'll know, we're going to be in Thailand. But when we were in Washington State, we went to an elite, health club. We went to an organic farm, a library, and a health food store. So we tried to reach diverse pockets of people, teach them about homeopathy. If there are local individuals who are members of the who are professional members of the National Center for Homeopathy, we introduce the local people to them, and we call these meet and greets. And so we give people a background in homeopathy. We give them some samples of homeopathic medicine so they could take advantage of what we're teaching them right there. We try to customize what we're teaching to the people who come so that it's useful information that they could use, in their families for needs that make sense to them. And so our meet and greets for the next month are going to be we have several lined up in Philadelphia. So we'll be going to a health food store. There's a homeopathic study group, and holistic moms will be meeting with us. And we've also been meeting, I know that our executive director, Chris Donka, and Lynn Wagner, she's our treasurer, they met with people from Weston A. Price. So we're meeting with lots of different organizations, different communities, one-on-one and in person now, so that we can introduce homeopathy. So that's the next place I'll be on the road.
I mean, that is just so commendable. I mean, that's incredible work because it's real grassroots level, and that's what makes the changes for generations to come. So kudos to both of you actually for that, amazing. Parting thoughts on the JAHC before we go for today. I mean, it's been an absolute honor, absolute pleasure. And of course, I hope it goes extremely well, which I know it will. Any parting thoughts as far as the JAHC is concerned, Marjorie?
No, I just like to say, come join us on the sneak peek day. At least it's completely free. It's our gift to you, and we've prepared many, many useful things for all levels of homeopathy, and we'd love to interact with you. So yeah, come see us on the sneak peek, and you can decide if you want to join us for the rest of the conference.
Lauri?
And I'll carry that forward. I'll say, come to the conference.
Yeah,
It's
come in person if you
know,
can.
so many people practice homeopathy by themselves in their homes for their families. So many people, the professionals, practice in individual clinics, private practices. Most of us don't work in hospitals in the US, and so we don't have a chance to interact. And I just want you all to know, anyone who's listening, it feels yummy to be in the presence of so many colleagues. You can share your challenges, you can share your joys, you could sit with someone and break bread with someone. And it's just, it happens. Our conference is in April. It's a beautiful time of year. The setting for the hotel is lovely. It's almost like a park-like setting. You can walk everywhere. There's a zillion million, organic restaurants within short walking distance.
Very short.
So it's lovely, and I hope anyone who's listening comes up and says hello to Marjorie or to me.
Yes.
We'd love to greet you in person, give you a special welcome.
Absolutely.
It's been an absolute pleasure, as I've said. It's really fantastic, actually. So thank you so much, Vera, for your time today, and the best of luck. And of course, I'm quite sure that you will send me some promos from the JAHC and during the conference itself, which we can share as well with the world.
You bet.
Yes. Thank you for having us.
Thank you so very much. Take care, and I will speak to you very, very soon indeed.
Okay.